to Keep the Bastards Honest, the podcast of the Australian Democrats. I'm your host, Elana Mitchell, and on this episode, it's a health election. Picking up from our last episode, I'm going to take you through what is essentially the other half of the cost of living crisis: health and access to healthcare. The growing inequality in Australia is exacerbated by the increasingly difficult access to quality healthcare that the electorate is experiencing. Poor physical, mental, and dental health has profound impacts on people's economic security and ability to live productive and fulfilling lives. So let's explore the suite of policies that the Australian Democrats have developed to address these increasingly urgent issues facing Australia. This episode was written, recorded, and produced in Whadjuk country. I pay my respects to the traditional custodians of these lands and their elders past and present. Sovereignty never ceded. Our first policy platform is, fittingly, good health. So here's the issues. Despite Australia's semi-universal public healthcare system funded through Medicare, the Pharmaceutical Benefit Scheme, and through subsidised private health insurance, there remains significant inequity in both access to and provision of high-quality healthcare, evidenced by significant discrepancies in the health outcomes for Australians living in rural and remote locations, Aboriginal and Torres Strait Islander people, people with mental illness, and people living in socio-economic disadvantage. Australia faces additional challenges to its healthcare system: an ageing population and an increasing burden of chronic disease is placing pressure on physical and financial resources, including healthcare providers and care facilities. So our plan is to prepare for the now inevitable health consequences of global warming: heatwave-induced dehydration, heat exhaustion, vector-borne disease, burns, respiratory illness, trauma related to extreme weather events, and loss of homes and livelihoods. A health and emergency services workforce review to ensure Australia is capable of addressing emerging health challenges. A national audit of health facilities and resources to meet emerging health challenges. A centralised Centre for Infectious Disease in the NHMRC with responsibility for research and health response planning. Develop a plan to fix the health inequity experienced by Aboriginal and Torres Strait Islander peoples, those living in rural and remote communities, and those experiencing socio-economic disadvantage. Better funding for non-emergency surgery in public hospitals is needed, so waiting times are reasonable. Better funding for mental health services for disorders of anxiety, depression, bipolar, alcohol and substance abuse, which together make up 68% of the disease burden. Develop a plan for gender equity in health outcomes, particularly for disadvantaged women and girls who experience chronic health conditions or male partner violence. Develop a prevention plan for injury in sports and encourage a wider set of physical activities for all age groups. Support and promote Aboriginal community leadership, prioritise Aboriginal culture and community-driven initiatives by co-design to improve health outcomes. Invest in public health interventions to reduce chronic diseases caused by smoking, poor nutrition, low levels of physical activity, and obesity. 2 in 3 Australians are overweight or obese. Reform the Health Star rating system so it is mandatory for all foods, encouraging healthier food choices. Invest in more digital and telehealth services with better support infrastructure. Extend the dental health programs for pensioners and children, starting with universal preventative dental care and incrementally moving towards universal dental health services. Bring health and medical research funding to 3% of the total health budget. Address medical workforce shortages, especially GPs and doctors in rural areas, and increase rebates for longer consultations to improve the quality of care. Now, here's the evidence. A high-quality and comprehensive healthcare system that meets the diverse and complex needs of an entire population is essential for the maintenance and growth of a country's overall prosperity. Quality healthcare is evidence-based, provided to those who will benefit, safe and patient-oriented. An effective and efficient healthcare system recognises and respects that while healthcare is a universal right, access to healthcare must be equitable. Next up, youth mental health. So, before we move on to the rest of the episode, I need to give you a heads up that it will be tackling youth mental health, gambling, and family violence. These platforms make reference to suicide, depression, eating disorders, and family and domestic violence. If any of these issues could be triggering for you, feel free to skip the rest of this episode and come back for our next one. Thanks. Quote, a world-first review into youth mental health describes a lack of action as a scandal that is having big implications for the health, well-being, and productivity of young people. Professor Patrick McGorry, Origin Australia's Centre of Excellence in Youth Mental Health. And a second quote, we're terrified of the climate, of the loneliness that we're experiencing, the cost of living, conflict throughout the world. Finlay Hewlett. The issues. The Royal Commission into Victoria's mental health system found that demand for youth mental health services has overtaken capacity, community-based services are undersupplied, the system has become imbalanced with an over-reliance on medication, getting help is difficult, access is not equitable, the system is driven by crisis, and emergency departments are used as entry points. The recent national study of mental health and well-being showed the prevalence of operationally defined mental disorders in 16 to 24-year-olds rose by 50%, from 26% in 2007 to 39% in 2021. The rise in young women was greater than in young men, with rates of 48%. The HILDA survey of 17,000 households and people confirmed a long-term decline in the mental health of this age group. While the 150 Headspace centres Australia-wide provide primary mental health care, the rising number of new cases is now overwhelming their capacity to provide timely access. The funding model is now no longer adequate to recruit and retain a workforce, given that other, more lucrative options exist. Young people with more severe, complex, or persistent conditions need more expert, sustained, and intensive care. Yet, this next level of secondary care is largely absent, resulting in a large cohort of young people described as the missing middle. So our plan: identify the trends that are increasing mental disorders, such as suicide, cost of living, climate distress, and social exclusion. Intervene early to prevent more severe disabling illnesses, a more effective funding arrangement, and a transition to a community mental health model, such as that advocated by Origin Youth Mental Health. Provide specialised care for those with complex disorders, the missing middle, and expand the Early Psychosis Youth Services program to include regional areas. Currently, this program is in 8 metro regions only. Scale up evidence-based solutions to youth mental illness. Provide youth-specific crisis housing and arrangements for independent youth on low incomes. Create clear pathways from crisis intervention to sustained community-based support. Increase rates of job seeker, youth allowance, and Commonwealth rent assistance. Fund more research into eating disorders, substance abuse, physical health and exercise, early psychosis, personality disorder, and effects of social media. So here's the evidence. Over 75% of mental health issues first occur before the age of 25, and suicide causes the largest loss of life of young people in Australia. 39% of young Australians have a diagnosable and treatable condition, but 50% of them receive no access to care. According to the Australian Institute of Health and Welfare, The leading causes of mental health disorders for females were anxiety, 17.1%, depression, 12%, eating, 7.3%, and bipolar affective, 6.1%. And for mental health disorders in males, suicide and self-inflicted injuries, 12.7%, anxiety, 10.7%, depression, 6.8%, and the autism spectrum, 5%. Worldwide mental health issues account for 45% of the disease burden for 10 to 24-year-olds, but only 2% of health budgets globally are devoted to mental health care. Those figures are a little better in Australia, but there is still a huge gap in spending on mental health compared to the scale of the crisis. Cost of living. The Lancet Psychiatry Commission on Youth Mental Health identified factors contributing to mental ill health, such as cost of living, climate change, housing insecurity, and growing intergenerational inequality. A report led by Origin researchers and drawing on responses from almost 20,000 people aged 15 to 19 to the 2023 Mission Australia Youth Survey shows the proportion of young people who identify the economy and financial matters as one of the most important issues facing Australia has almost tripled in 2 years, from 11% to 31%. Financial struggles can affect a young person's chances of getting a good start in life and can often push them into poverty and homelessness, making it difficult for young people to fully engage in education or find employment, and often leads to feelings of hopelessness. Offending behaviours. Rates of criminal offending and onset of mental illness are highest among adolescents and young people, and they are less likely to have access to mental health services. Climate distress. Young Australians reported that climate distress impacted their functioning, their hope for the future, and their mental health. 6 in 10 young people are worried about climate change, according to 2023 Mission Australia Youth Survey. Social exclusion. There are strong links between social exclusion and poor mental health outcomes such as loneliness and high psychological distress. 60% of the 18,000 people aged 15 to 19 in the 2022 Mission Australia Youth Survey experienced social exclusion in the prior 12 months across the domains of relational difficulties, financial hardships, housing challenges, and/or education and employment. These young people showed significantly poorer mental health scores than their peers who were not socially excluded. Eating disorders. Eating disorders most often occur in young people, and while current treatments can be effective for some, around half are unresponsive to treatment. Anorexia nervosa is associated with the highest death rate of any mental illness, with poor long-term recovery rates for a large proportion of individuals. Bullying. Being bullied can affect a person's performance at school, uni, TAFE, or work, and can continue to affect them throughout adulthood. Experiencing bullying can also increase the risk that someone will develop depression and anxiety in the future, and it can increase the risk of self-harm, suicidal thinking, and suicide. Social media. Research by Headspace shows that social media is something young people feel is putting more and more pressure on them. Spending too long on social media is associated with higher levels of mental health problems, including anxiety, depression, and psychological distress. Other impacts include cyberbullying, sleep problems, and concerns about body image. For advice on mental health, we've provided a link in the show notes. Next up, gambling harm. Now, this probably doesn't seem an obvious health issue or cost of living issue, but gambling, while a legal and strongly regulated pastime in Australia, can have catastrophic impacts on people's lives. So here are the issues. Australians bet a staggering $244.3 billion in 2022 and 2023 on legal forms of gambling and lost around $25 billion that year, representing the largest per person losses in the world. Gambling has grown to become normalised in Australian culture, encouraged by gambling advertising and the link to sport. Almost 9 out of 10 sports bettors are men, but women, who were once largely excluded from gambling, are now targeted by the betting sector, made easy by the ready access to gambling on smartphones. Clever marketing, weak regulation, and technologies such as sports betting apps and online casinos are increasing opportunities to gamble. Nearly half of gamblers are at risk of or already experience harms from gambling. These include financial hardship, relationship breakdown, domestic violence, poor work productivity, criminality, insomnia, depression, and suicide. Children are being groomed to gamble by advertising, and some even have sports betting apps and accounts. The federal government has deferred any reforms that might have protected children and gamblers. The parliamentary inquiry, You Win Some, You Lose More, initiated and chaired by the late Peter Murphy, made 31 unanimous recommendations, mostly on advertising of gambling. None has been implemented to date. So our plan: ban gambling advertisements on platforms including free-to-air TV and radio, paid streaming services, social media, and external billboard-type advertising. Consider additional measures to strongly discourage overseas-based media platforms displaying advertisements for gambling that allow Australian gambling. This could include fines for Australian businesses using those platforms. Transfer the responsibility for casino regulation to the federal government and establish a national casino regulator and online gaming ombudsman as recommended by the Bergen Report. Australia is a hotspot for global money laundering, much of it occurring in casinos. Enforce current money laundering laws, require casinos to implement programs, training, and controls with independent testing for compliance. Ban cash, cryptocurrency, or other anonymous payment mechanisms to place bets and to receive winnings using any digital platform or electronic gaming device, and ban such transactions over designated thresholds for other forms of gambling. All gambling transactions to be categorised on bank statements as gambling or wagering in order to provide feedback to individuals on their transactions. Extend the current online National Self-Exclusion Register to include all forms of gaming and provide options for self-exclusion registration with banks in addition to betting agencies. Note that some banks allow gambling blocks, including Bank of Melbourne, credit cards only, and Commonwealth Bank, National Australia Bank, and Westpac, debit and credit cards. For children under 18, enforce strict proof of age before entering gaming venues. Legislate against the use of microtransactions in online games available to children. Ensure that understanding of the harms of gambling is part of the curriculum in personal development, health, and physical education in all high schools. Provide focused support for children whose parent has been identified as a problem gambler and the partners or spouses of problem gamblers. Here's the evidence. According to the Australian Institute of Health and Welfare, Growing Up in Australia found approximately 1 in 6, or 16%, of Australians aged 16 to 17 participated in underage gambling in the 12 months prior to the survey, most commonly private betting. 2 years later, when aged 18 to 19, almost half, or 46%, of the same cohort reported having spent money gambling. Vested interest is playing out and looks like it's winning. Governments, particularly state governments, have vested interest too. In financial year 2020, Australian governments raised around $5.8 billion in revenue from gambling. The year before, it was an all-time high of $6.6 billion. Sport, television, and a revolving door of former MPs and lobbyists are all deeply enmeshed in gambling, and this has become a powerful force to reckon with. Embarrassing to us all was the Prime Minister's claim that banning gambling ads will drive people offshore. Yet another excuse for the status quo. And this leads us into our most heartbreaking policy platform: Addressing family violence. Quote, "There is no panacea to gendered violence. There is no one solution. We will not go close to achieving the government's ambitious goal to end gendered violence within a generation unless we pursue a prevention agenda that aims to prevent gendered violence and coercive control within the short to medium term. We need a flourishing and interconnected prevention system embedded in and connected to frontline services with appropriate resourcing and incentives to focus where they have the most preventative effect. And ultimately, as prevention advocates, we need to hold ourselves accountable to the goals that we set for ourselves and the promises we make to the community." Jess Hill and Michael Salter from UNSW. The issues. Incidents of family violence are escalating and, more alarmingly, 58 women were victims of domestic violence, up from 35 in 2022. 2024 is worse, with 62 women dead by November. Women are over 8 times more likely to be victims than men. It is clear that the gender equality approach is neither working nor evidence-based. There are several reasons for this. Governments, time and time again, have allowed vested interest lobbyists, for example, alcohol, gambling, and X-rated pornography, to avoid regulation. They normalise practices that are harmful and dangerous, particularly for women and children. The E-Safety Commissioner's recently recommended verification for online porn was rejected. Gambling advertising laws were watered down by the Prime Minister, and a ban on under 16-year-olds using the internet seems likely to fail. There is insufficient funding for survivor support, preventative and reactive. Domestic violence is a leading cause of homelessness, exacerbated by growing socioeconomic drivers. A 2016 personal safety survey showed 60% of single mothers were survivors of domestic violence, and half of them were living in poverty with their children. Family violence is worse in Aboriginal communities, and these communities are also overrepresented in being affected by almost all the other drivers of family domestic violence outlined here. It's our plan. Bring accountability to the cause of stopping domestic violence by measuring success in prevention and consequences for perpetrators. Bring a stronger focus on prevention of and recovery from intergenerational trauma and child abuse. Tackle the business models that cause or contribute to domestic violence, such as alcohol, gambling, and drug use, introducing measures such as those used against tobacco. Upskill practitioners in providing interventions for perpetrators of violence. Respond to the prevalent childhood trauma in Australia through primary care and mental health services. Provide adequate funding for services, including income support, that allows women to separate from abusive relationships. Continue to fight for gender equity. Provide adequate funding for education and rehabilitation services. Adequately fund mental health supports. Increase the focus on perpetration and working with men and boys in the prevention of violence against women. Frameworks such as Change the Story, Men in Focus, and the National Plan outline key actions for working with men and boys. The evidence. Quote, "Family, domestic, and sexual violence is a major health and welfare issue in Australia, occurring across all socioeconomic and demographic groups, but predominantly affecting women and children. These types of violence can have a serious impact on individuals, families, and communities, and can inflict physical injury, psychological trauma, and emotional suffering. These effects can be long-lasting and can affect future generations." The Australian Institute of Health and Welfare. 2 in 5 women have experienced violence since the age of 15. 1 in 6 women have experienced physical or sexual violence by a current or former partner, and for males, it is 1 in 16. In Australia, intimate partner violence contributes to more death, disability, and illness in women aged 25 to 44 than any other preventable risk factor. 75% of victims of domestic violence reported the perpetrator as male, while 25% reported the perpetrator as female. Gender inequality continues to disempower women. On average, 1 woman every 9 days and 1 man every month is killed by a current or former partner. Recent studies have shown that almost half, 47% of the women who had experienced male perpetrated sexual assault in the past 10 years believed alcohol or another substance contributed to the most recent incident. The 2024-25 budget allows $925 million for the Leaving Violence program over 5 years, $4.7 billion for gender-based violence prevention, and the commitment from the government is to end violence against women in the next decade. He's hoping they achieve it. So, as you can see, there are a lot of more subtle, more insidious factors contributing to the cost of living crisis. Labor's pledge to invest $8.5 billion in Medicare bulk billing is a welcome one, but long overdue. And I think I've said it on a previous episode that the moment Dutton pledged to match the investment, Albanese should have submitted the legislation to Parliament and forced Dutton to vote for it. Instead, he's left it as an election promise rather than a firm achievement the electorate can reward him for. And let's not get started on the coalition and the man voted worst federal health minister in the history of Medicare by doctors. I think the coalition has shredded any credibility they have in the preserving and investing in Medicare space. After Dutton's various backflips, somersaults and cartwheels over cutting 40,000 jobs from the public service, I'm not sure voters are willing to believe that he won't take a chainsaw to health services and Medicare in the event he's elected Prime Minister. The provision of comprehensive services to address the mental health and family violence crises is absolutely crucial and requires significant investment in political leadership to achieve any of the stated goals in eliminating gendered violence in this country. This episode has been pretty heavy going across a number of difficult topics. I didn't expect it to be quite this dark when I put together this suite of policies, so it was a bit startling when I was recording it. If you've come this far in the episode, thank you for sticking with me. I'll be back soon with more of our policy platforms. But until then, take care. Keep the Bastards Honest is brought to you by the Australian Democrats. This episode was edited and produced by me, Elana Mitchell. If you'd like to keep in touch, you can find us on Facebook, the platform formerly known as Twitter, LinkedIn, Instagram, Threads, Blue Sky, Spoutable, YouTube, and TikTok by searching for Australian Democrats. And you can see what we stand for, what we value, and what our policy positions are at our website at democrats.org.au. Email us at info@democrats.org.au. Until next time, thanks for listening.